Hey viewers, you're watching The Savera and I'm Vidhi Joshi. Delhi continues to struggle under a thick blanket of toxic smog as air quality plunged further into the very poor and severe categories this Sunday, that is today. The national capital's pollution crisis, which has persisted for over a week, worsened overnight as a dense layer of smog blanketed the city, reducing visibility and making it difficult for residents to breathe. At 7 a.m., Delhi's overall air quality index stood at 377, and by 10 a.m., the situation had become alarming, with several monitoring stations recording AQI levels above 400, placing the city in the severe category. Areas such as Anand Vihar, Chandni Chowk, Nehru Nagar, R.K. Puram, Rohini and Vivek Vihar emerged as the worst affected. Real-time data later show that Delhi's overall AQI had climbed to a hazardous 405. Concentrations of PM 2.5 were recorded at 277 micrograms per cubic meter and PM 10 at 359 micrograms per cubic meter, both far exceeding the World Health Organization's safe limits of 15 and 45 micrograms per cubic meter respectively. Levels of carbon monoxide also rose sharply to 489 parts per billion, further worsening air quality. Meteorological conditions have added to the crisis. Notably, the India Meteorological Department reported humidity levels as high as 98% on Saturday, coupled with shallow fog and smog that reduced visibility to 900 meters at Safdarjung and around 1.3 kilometers at Palam. Light southwesterly winds blowing at just 4 to 10 kilometers per hour trapped pollutants close to the ground. According to the Central Pollution Control Board, Delhi's air is likely to remain in the very poor category until at least November 4, with only marginal improvement expected thereafter. Notably, health experts have also raised serious concern over the potential consequences of prolonged exposure to such hazardous air. Notably, Dr. Gopi Chand, former AIIMS doctor and senior, has advised people with chronic lung or heart conditions as well as children and the elderly to leave Delhi for the next 6 to 8 weeks if possible. He warned that the current air quality poses severe risk to vulnerable groups, increasing the likelihood of breathlessness, respiratory distress and dependence on oxygen support. Notably, Dr. Khilani explained that air pollution has now become one of the leading causes of lung disease. Studies at AIIMS indicate that prolonged exposure to polluted air hampers lung development in children. While tobacco use previously accounted for nearly 90% of chronic obstructive pulmonary disease cases, today nearly half of such cases are linked to indoor and outdoor pollution. Similarly, around 40% of lung cancer patients have no history of smoking. Beyond the lungs, air pollution has effects the heart, brain, kidneys, intestines and overall immunity. In response to the deteriorating conditions, the Delhi government has implemented emergency measures under the directives of the Commission for Air Quality Management. Entry of commercial goods vehicles not compliant with the BS6 norms or not registered in Delhi has been restricted, allowing only CNG, LNG, electric and BS6 vehicles. Environment Minister Manjinder Singh Sirsa inspected air quality systems at Anand Vihar, one of the worst affected zones, and stated that continuous monitoring and water sprinkling operations are being intensified across all the 13 identified pollution hotspots. Experts attribute the worsening air quality to low wind speed, temperature inversion, vehicular emissions, road dust and stubble burning in neighbouring states, that is, like Punjab. Similar weather patterns last year led to one of the Delhi's worst smog episodes by mid-November, and meteorologists warn that this season could unfold in a similar manner. As visibility drops and pollutant levels soar, health authorities are urging citizens to stay indoors as much as possible. Use N95 mask when venturing outside and avoid strenuous outdoor activities. For now, Delhi remains shrouded in toxic haze, waiting for the winds to clean the air. That's all for now. Stay tuned to The Savera for more updates. Do like, comment and subscribe to the channel.